Good evening, everyone. On behalf of Department of Biomedical Engineering, SRM Institute of Science and Technology, I welcome you all to the 6-day faculty development program on harnessing AI for healthcare excellence, innovation, insights, and impacts. It's my honor and privilege to introduce the resource person for today's session, Dr. Prashant Ashokan, postdoctoral researcher specializing in optical-based biosensors in healthcare. He is currently at FZU Institute of Physics of Czech Academy of Sciences, focusing on developing biochips using UV lithography techniques. He did his PhD and PG at Vellore Institute of Technology, Vellore, and his UG at JPR Engineering College. He worked as a researcher at Vellore Institute of Technology, where he designed and developed optical fiber sensors for detecting volatile organic compounds. Dr. Prashant's expertise includes lossy mode resonance, surface plasma resonance, etc. He is proficient with advanced instruments and software tools such as RF and DC sputtering device, optical spectrum analyzer, and COMSOL multiphysics. Thank you for accepting our invitation, sir. I welcome you to take over the session now.
Thank you so much for your warm welcome, ma'am. So, am I allowed to share my presentation here? Can I share my presentation? Hello. Is can
yes,
I share?
Sir. You can start your sharing.
Yeah. Thank you.
Yes, sir.
Yeah. Is my presentation is visible? So I think.
Yeah.
Yeah. Okay. Thank you. Good evening, everyone. Thank you so much, Dr. Indumari, for your welcome. And I'm Prashant Ashokan, and I work in optical fiber sensors and optical planar sensors for biomedical applications to detect some biomarkers regarding the biomedical application, as well as I'm working with environmental pollutant applications. So today I'm here to give some talk about the topic optical sensors and AI in biomedical applications, paving the way for healthcare systems. So this session is not much about the artificial intelligence. So I'm going to give some overview and the demand of AI together. It's about like how we develop the sensors to detect the biomarkers, because of course the biomedical system is completely more about the sensors. So developing the very high sensitive and selective sensors to detect some biomarkers are still in a very big research gap. So there's a lot of different techniques are available to detect the biomarkers. So I work in optical sensors. So my PhD is completely about a fiber optic sensor. So I'm just combining together to give some overview about all my data and results. So these are the main contents that I'm gonna present it now. So the first is about I'm going to talk about the volatile organic compounds and what are the different sensing techniques that I use to detect these volatile organic compounds. So the first thing is uh, what is this volatile organic compounds? Why it has to be detected? What is the role of application here? Is these volatile organic compounds are something called as it occurs in our human body. It is also present in our ambience. There is a number of VOCs are available. So the reason for detecting these VOCs is this can act as biomarkers. In the sense we all know when someone is affected by some disease, we go to we discuss with the medical practitioners and we know our disease stage through the blood test, so which is something invasive technique. So nowadays there is a demand for non-invasive techniques diagnosing the diseases through the non-invasive procedures. So there are we use this urine samples to know the condition of some certain diseases, as well as there are other non-invasive techniques uh, exhaled breath analysis. So in exhaled breath, we can see this volatile organic compounds. So this volatile organic compounds concentration for a normal person is different. And also if for the deceased person, the concentration of VOC is again different. For example, if person is affected with diabetics, we can see the content acetone in his exhaled breath as well as in urine sample, as well as it emits all the body fluids like feces, sweats, saliva. So on different medium, these VOCs are emit away from our human body. So their concentration in this liquid samples are quite different, because if a person having very controlled diabetes, when the sugar level is very controlled, in their exhaled breath, the acetone concentration is something around 0.3 to 0.5 ppm. This is something proven. If the person is having very uncontrolled diabetics, their acetone content in the exhaled breath is very, very high. It may reach up to 10 to 15 ppm, which is quite large. So to detect these sensors, to detect these compounds, there is a demand for sensors to selectively capture those biomolecules in the exhaled breath. So this is something uh, we can continuously monitor it, because the exhaled breath is quite sufficient to detect these compounds. So with this context, we are preparing or we are developing the VOC sensors with the help of optical fibers. So I'm just want to give some overview about how these VOCs are developing inside the body. So how this VOCs are originate from our body. So just ignore the text. There are two different things in our body. One is free radicals that are oxygenated atoms, and it's basically one unpaired electron atoms. So when there are free radicals, or it generally produced in a human body. But when the free radicals are more high, it causes damage to the major components of cells, DNA, proteins, and this is one of the threat. When the free radicals are accumulate more. So in order to suppress it, we also have this antioxidant. These antioxidants are nothing but vitamin A, C, and E. Like we consume food and we take vitamins from the foods. It's just to suppress these free radicals. When our body fails to suppress these free radicals, when their accumulation is high, it results in a condition called as oxidative stress. As a byproduct of this reaction, these volatile organic compounds are naturally produced. When a person is having some diabetics or some liver disease or some any kind of disease like breast cancers, there will be some specific VOCs whose concentration will be very different when the disease is in control stage, when the disease is out of control. So by understanding the concentration variations of this VOCs, the severity of the disease can be predicted. So that's why the people have started working on developing the sensors to detect the VOCs, because this is going to replace conventional techniques like blood test and some imaging techniques as well. So there are much research are going with this non-invasive breath-based technique. So this called as a breath biopsy actually. So we are developing a sensors on it. So as I said, these VOCs are released in a different body fluids like breath, blood, urine, feces, and skin. So as a study, like I after two things, one is exhaled breath, that is gaseous state VOC, and another one is urinary VOC. So like the benefit of these things are like it is disease prognosis can be done after visiting the doctors, like we can if we have some portable device to detect these VOCs in our excel breath, we can and easily see the betterment of our medication. So that is something like prognosis can be identified. And then the urinary VOCs, these are something, for example, if a person ketone level in urine is very high, we know that the person will be affected by the diabetic ketoacidosis. So if we have some portable sensors to detect these volatile organic compounds, that would be better to, because these are painless procedures. So there are also several biomarkers like ethanol, heptane, isoprene, and each disease will be having some different biomarkers, and the concentrations for the healthy person and the severe person will be different. So to detect these VOCs, there is already some conventional techniques are available. Like, of course, we all know about this gas chromatography technique. So that is something used to detect the molecules and lower molecular weights. And also we have some proton transfer reactions and ion flow tubes and flow flame and ionization, some chemiresistive based sensors. There are different types of techniques are available. But the problem with some of the existing techniques is they are like complex setup, like it occupies very huge space and it is a time consuming process. And also there is this flame detectors or something like they are low response to some few molecules. So they can work only for the certain molecules. And also the chemiresistive sensors, like though we develop these sensors, but uh, we need to give some working temperature. So that is one of the major disadvantage. So here I would like to say like we also in the need of very room temperature based sensors. So when someone is working with this biomedical area, like when someone want to design the temperature, there is a huge demand for the room temperature based sensor. So that's why like we are going to the optical fiber based sensors. So optical fiber sensor is like it just measure its physical quantity based on the modulation of intensity, phase, or polarization of light traveling through the optical fiber. It's called optical fiber system. It's the concept is quite simple. Like we take the optical fiber and the one end we just apply a light, other end we collect it. So that is the concept of optical fiber. We use this optical fiber for the communication purpose, and of course, nowadays all this uh, different applications are using this optical fibers, and we are using the same optical fibers as the sensors. So they are small in size and it occupies very less space. And with this optical fiber-based sensors, we can develop some many types of prototypes. So in this optical fibers, there are different techniques like MSMV based technique, surface plasmon resonance, and the loss immunofluorescence. I just want to give some overview about these techniques because at the end of this session, I just want to give an impact about when we develop the sensor, we can use these sensing techniques to develop as an end product like a prototypes. So what is this evanescent wave sensing mechanism? It's simple. Like when you take an optical fiber, like we all studied in our school physics, like the optical fiber is a combination of core. On top of it, there is a cladding. The light propagates inside this optical fiber through this total internal reflection condition. So this total internal reflection condition occurs only the refractive index of cladding must be lesser than the refractive index of core. So to develop the sensors, what we do is we just replace the cladding. We just remove the cladding and we coat some nanomaterial, some selective biorecognition element. If I want to develop a sensor to detect some biomarker for cancer applications or any cardiac, let it be if I want to detect some troponin T, cardiac troponin T, that is one of the biomarker for this cardiac heart muscle leakages. So if I want to capture that biomolecule, what I do, I just take the optical fiber, I just functionalize this optical fiber by removing this cladding and replacing it with some antibodies which can selectively capture this sunlight. So that is one of the conventional way to develop this optical fiber based sensors. So what is this evanescent waves? Like you can see at the left hand side there is a light input, lighting. At the other end we are just collecting the light. So when our antibiomolecules or something sits on top of the surface, there will be a variation in the intensity of the light. So these are something really sensitive, like because it works in a refractive index mode. Like of course, everyone is quite used to this word refractive index. If you vary the concentration in very minute way, because you are in picomolar, nanomolar, like the biomarkers concentration in blood are very less. So if you vary very small concentration, there will be huge difference in the reflected light intensity. I mean, the light which comes out of the optical fiber will be very different. So by using this simple technique, we can develop a prototype of this optical fiber-based sensor to detect some um, volatile organic compounds or any kind of biomarkers. So how do we develop these sensors? There are three different steps that we follow. One is like we do the chemical etching and then we deposit the sensing layer and we just, of course, when we deposit the sensing layer, we need to characterize the sensing layer, what the sensing layer is all about. I'm just gonna give some overview about all these steps. The first thing is we just take the optical fiber. We can see the blue color stick-like structure. So we just remove the optical fiber cladding by using the chemical that is HF. So once we remove the optical fiber, we replace the optical fiber with uh, sensing layer. For example, the photograph that I'm showing, I'm just depositing the sensing layer, this metal oxide sensing layer to detect this volatile organic compounds. So I'm just, this photograph is all about this RF magnetron sputtering technique. So by using this sputtering technique, we are just depositing the metal oxides on top. And we are rotating the fiber to develop the uniform layer on the optical fiber. Once we coat it, we just characterize these things. Like I'm not going much deep into these characterizations. I'm just we always measure what thickness is about. And when I coat this layer on top of the fiber, how stable these things or their optical conditions are really useful. In the graphs like you can see the optical constants measured using this Lorentz model graph. This is something about like how much light that it can absorb. For example, this is here I'm coating one layer. It is called as tin oxide. It's a tin oxide metal oxide thin film. So I'm just coating on the optical fiber. When the gas molecule sits on the surface of the tin oxide, the refractive index condition will vary. When the refractive index condition of this material is varying, the light propagating inside the optical core will vary because it sits on the top of the core. The sensing layer is sitting on the top of the floor. When the gas molecule sits, there will be variation in the reflected light intensity. So that is a concept. So when someone wants to develop the sensor in a very cost-effective way, we can utilize this technique, evanescent wave technique. So this is the gas sensing setup like that we have. The one end we connect the light source, and the other end we have the spectrometer. Spectrometer is just collect the light. So then inside the chamber we just pause the different concentration of gases. So here in this work, we just developed the different organic compounds like acetone, which is one of the best biomarker for this diabetic applications, and also the IPA is for the diabetic, and ethanol and acetophenol. So acetophenol is one of the potential biomarker for the breast cancer application that recently literature they have been talking about. So we can see this is the output of the optical fiber sensor. This is just an intensity spectrum. Uh, I'm just overview about this is like when I pass a different concentration of gas, the concentration of the spectra is reducing, which means like the light which comes out is keep reducing when the gases, when I keep on passing the gas inside the chamber, the spectra is reducing. So that gives information about what concentration is present inside the chamber. So that is a concept of this evanescent wave sensors. So once we prepared, we do some like sensor parameter studies like sensor response, and also and another important thing is the limit of detection. For example, the term limit of detection is something when someone wants to develop this sensor and sell it to the market, and people always think about how lower limit that your sensor can detect, how small that your sensor can detect, because all the biomarkers which present in our body are very low quantity. They are very less. So in order to detect those things, our sensors should be very sensitive to the lower concentrations. Nowadays, here now I'm working in Czech Republic with a different research team. They are working with this surface enhanced Raman spectroscopy as well as this fluorescent based technique. So they are just working to detect the single molecules. They are just focusing on a single molecule. They're pre-concentrating. So those are different terms. The concept here is when you develop the sensor, it should detect a very low quantity. So from this gas, we can see that I just vary the concentration of this gas in a ppb level, like from air ambience to 1 ppm. That is very less. So this is something which fits into the acetone concentration in our in our exhaled breath. If a diabetic patient is having the acetone, its concentration definitely for the severe condition will be up to 10 ppm. So we want to produce the sensor which should detect the concentration lesser than the threshold level. So that is our aim. So once these are some of the graphs that like we could reach down up to ppb level, and these are the other like sensing parameters like response and recovery, like how quickly your sensor is responding, and how stable your sensor. So when someone wants to develop the sensor, these are the parameters they have to study. And like in our work, like the problem is like selectivity, because we are not working with this like very selective immobilization. We are just working with some cost-effective metal oxide thin films. So it just detects everything whatever we apply on the surface. But our ultimate aim is the selectivity, because we are focusing on one single molecule. So that is something is quite lagging here, and that is something that we are working on it now. So then with the development sensors, we can also develop a simple prototype. This is something, a simple box. The one end we connected to the LED, and other end we just connected the multimeter. This just other end I just connected the LDS, and the LDR is connected to the multimeter. So when I apply the gas inside the box, there is a variations in the resistance. So that resistance is read in multimeter. So the concept for bringing this presentation to this FDP here is like when I detect these values, so I want to continuously monitor these values. So I want to put it in some algorithms and like machine learning algorithms, and based on the data that I collected, I just want to develop a model, and I want to predict the concentrations for the next day, concentration for the next week. So based on our previous data that I should predict the values or for the next hour. So that is when we write some project about these kind of works, like as a tail end that we try to always include this machine learning concept into this for the prediction. So that is quite fancy things, and now people are quite focusing on combining the sensors, and this is a better advantage than the other techniques here. So these are some of the sensors that I worked. And also, I'm not going much deep into these things. This is something like MOS to molybdenum disulfide. So the one main advantage of this material is something like it is a stack. It has some gaps in between the stacks. So the gas molecules, the VOCs can diffuse, go into it, and sit on it. So when they sit on the surface, there will be again the intensity variation. So here you can see you can see in the square box, like there is each concentration, there is a reflected light intensity is reducing. So this is a concept of the sensor. So when we apply the gas, there will be variations in the output of the optical fiber. So by this some basic thing, in advanced way, like we selectively capture the molecule. To selective detections, we also go with the other technique called as surface plasmon based technique. This, I think, I don't want to go much deep into this. Everyone would be having some awareness about this plasmonics based sensor, SPR, surface plasmon resonance. I'm just assuming it, but uh, like I just want to give some simple talk about it. Like we all know this gold, silver, and copper. They are the noble metals. Uh, why do they call metals? Of course, they have the free electron. When you apply some electric field on top of the metal, there will be an oscillation of this free electron. That oscillated free electrons is called a surface plasmon wave. They propagate on the surface of the metal. So when the propagated wave, the incident electric field match each other, they result in a condition called as resonance. Uh, that resonance will give the, you can see in this graph, there is a dip here, and this dip talks about the resonance condition because one end we apply light, other end we collect the light. So when there is a resonance, there will be a very loss of light at one particular area. When we when we pour some blood molecules, when we pour some serum on top of the surface, there will be a shift in the other spectra. By observing this shift, the concentration of biomolecules can be predicted. So that is one of the precise sensing mechanism for this surface plasmon resonance. So there is a huge scope for this SPR-based sensors still, because recently we are working with this project called Versalid. It is like detecting the single molecules by using this plasmonic nanostructures. For example, we use some lithographic techniques to develop the different patterns of these gold nanostructures on the glass slides, and we enhance the electric field intensity, and we play with this biomolecule things on top of the surface, and we selectively capture the single molecule. So all these things are works under this principle surface plasmon resonance. So here I prepared on acetone sensors. Again, for this is for diabetic application. So these are some of the image about how that I'm functionalizing it. This is something like use the graphene oxide on top of the optical fiber. And I'm just keeping all the characterization. I'm not much going deep into. So the maybe I just talk about this efficient, that the image number 4. We can see this is the optical fiber, and on top of it, we are coated with the one material. In the next image, we put the graphene oxide on top. So we just confirm the presence of material on the surface of the optical fiber by using this technique. Then once we prepare the sensor probe, as usual, I showed this experimental setup before. We connect the light source on one end and the other source the detector. So in the previous spectra that I showed, it gives some intensity variation. But whereas here, it just shifts the wavelength. It shifts the wavelength. By observing the shift in the wavelength, the concentration of acetone is detected. So this is a concept about this surface plasmon resonance based sensors. So when someone is interested in developing the sensors, I would suggest this technique like SPR, which is something like when biomedicals who is having some biological knowledges, like they can work on it, this SPR techniques. And of course, these are something like comparison of two sensors, like one is giving the 22 nanometer shifting, other one is like enhanced to 42 nanometer shifting. So these are some of the data that we produce to detect this acetone concentration. So this is all for diabetic applications. And these are sensor response, how it enhanced from 3.25 to 6.8. And of course, the sensitivity is another important parameter to develop the sensors. Because when you develop the sensors, like sensitivity, limit of detection, and sensor response, these are and the stability of the response. So these are the 4 parameters. They are really important because at the end, like we expect a sensor should long last, and it should be sensitive, and it should be selective, and it should be very stable forever. So this sensor like can detect the 0.4 nanometer per ppm. I mean, the 1 ppm it shifts around 0.4 nanometer. The other one is it shifts around 0.8. So this SPR based work, like the wavelength resonant wavelength shifting, matters a lot. So the next other technique is LMR. This is something similar like both SPR and LMR, because this is some cost-effective technique as well. And whereas in SPR we could see only the one resonance, but whereas this in LMR there are multiple resonances. So with this technique, like we can increase the sensitivity, which means like if you develop a sensor, like if you want some sensor that should be very highly sensitive, we can play with all these techniques. We can decide which technique is suitable for this application and what is a sensing biorecognition element that we can function around it. So I'm just giving an overview about all this resonance techniques available, so that can be utilized to detect this biocomponents. So one of the advantage of this technique is, maybe I can put in the next slide here. This is the wavelength shifting. We can compare the wavelength shifting of the previous work to this. Whereas in previous work, there is only one shifting, like one dip was there. But whereas here, there are multiple dips. That is the advantage of this sensor. Like when we vary the thickness of the sensing layer, there will be multiple resonances. So all the resonances will shift when I apply the different concentration of gases. So this work exclusively, like we developed it to detect the lipid samples. Like I detected the ethanol concentration. So ethanol is the one of the biomarker, and as well as it is for the drunken driver applications, and as well as for other applications, the concentration of ethanol should be very precise. And also for the distillation, like distillation processes, like the addition of water content and is quite higher in this ethanol production. So to differentiate it, these things to differentiate it, like we need some sensor to say this concentration is quite high by observing the shift in the wavelength, resonance wavelength. For example, if you take a milk, like there is a lot of contaminations in the milk as well as the biodiesel. Other than the biomedical, I'm also talking about the other applications like milk adulteration application, food spoilage application, as well as the water pollution applications. And these are something called as like by it comes all under into this refractive index based sensors. Refractive index sensor is nothing but like when we vary the concentration of each sample will be having different refractive index values. So this sensor or all the sensors works as a refractive index based sensor. By observing the variation in the refractive index, there will be variation in the resonance condition. So by observing the shift or by observing the wavelength intensity, the concentrations of these unlights can be detected. So this is something again the comparison of different sensors, like it increase the sensor response from 5 to 8, and also the sensitivity it lasted up to 3.40 nanometers per volume percentage. So this the overall conclusion about here is like there are to develop these sensors, like there are different applications, different sensing techniques are there, like SPR, LMR, and MNSB to detect these volatile organic compounds. These volatile organic compounds are something it plays very major role in the disease diagnostic application, exclusively for a non-invasive disease diagnostic applications. And for that, I use this metal oxides as a sensing layer. Nowadays, metal oxides are quite outdated. Like we are just now moving towards a functionalization on the biorecognition element to selectively capture these adherents. I mean these VOCs, and like we can play with the thickness and by the overall the research gap here is like how do we enhance the sensor response towards this analytes in this particular biomedical application. So that is a concept of all this sensing technique and all this works. And coming to this AI, like the recent days, like when we work on this project, like, what I understand is like when I want to, there is a question and review about like how continuously you can detect the parameter. For example, this is something that I recently gone through one of the work. Like they are developing the sensors, the optical fiber sensors. Like there's a multiplex optical fiber sensors to detect the some of the body fluid parameters for the traumatic brain injury for people. They are just injecting this catheter, this optical fiber catheter into the brain, and by observing the cerebral fluids from the brain, and they are detecting the temperature, pH, glucose, and as well as the dissolved oxygen into the brain. So these are the parameters selectively they are detecting by using the tip of the optical fiber. By the edge of the optical fiber, they are just coating some biorecognition elements for the each component separately, and they are injecting into the brain, and they are collecting all this data to the spectrometer, and they are observing the intensity or some wavelength shifting. So they are putting all this data into the AI models. There's something, the screenshot we can see here. In the left-hand side image A, we can see there is an optical fiber, and whereas inside the optical fiber, there is a silica sheath, and the silica sheath, like there is one broadband LEDs they are using, and other end there is a photo detector. So which falls on the sensing films. The sensing film are something which interacts with the brain. We can see the image number C. There is a third image. That's the optical fiber uh, uh, probe. They are injecting it into the brain, and by observing there, this glucose T mean for temperature, and pH, and D was dissolved oxygen. So they are continuously collecting all the data from the traumatic brain into patients, and they are putting all these values into the model, and they are just predicting the predicting the concentration of these parameters so that gives a very bright impression about how the patient can sustain. So these are the recently, like, some bringing this sensors and this AI together will give some impact about the sensors in the biomedical application. So these are some of the work, like I just recently am a bit interested with it. So I would like to collaborate this sensors with this AI that would give as an overall complete project. So I think that's all about my presentation. I'm happy to answer all your questions, if any. Thank you for listening.
Participants, you can ask your queries now.
Dear participants, kindly ask if you have any queries.
அவ்வளவுதான் ஊற்றணும். இன்னும் 1/2 லிட்டர் இருந்துச்சு. Hello, sir. This is Dr. Bhanupriya from SRM.
Hello, ma'am. Yes.
Actually, I have a doubt. You are using screening layers of zinc oxide, AZO and zinc SN oxide.
Yes.
So, have you felt any temperature difference which is going to affect the sensor?
Yeah. Because these kind of sensors, these are just a basic study. Because as we work on this exhaled breath application, if we see in the exhaled breath itself, there will be variations in the temperature. Like when someone is having some cough or something, there will be some variations in the temperature. So we need to fine-tune these sensors with a different temperature ambience. Of course, there is a good question like all these sensors are quite sensitive to the temperature as well. So there are two different things. When if I want to answer your question, like there are two different things. One sensor is some materials like tin oxide. They really work good in the higher ambient temperatures. For example, if I give some additional power supply to that, I mean temperature to the sensing material itself, that gives a very huge difference in terms of resistance or in terms of optical intensity when it works in the high temperature. But our ultimate aim is to make a sensor to work sensitive in the room temperature, so that we are quite using this optical technique. Of course, in this optical technique itself, if I give some higher temperature to the sensor, there will be some better variations. So answering your question, yes, there is a temperature fluctuations are there. So we have to calibrate the sensor with the different temperatures as well as the different humidity conditions, because exhaled breath and exhaled air, like there is a gas from the ears as well. So when you use these things, there is a humidity interference as well. So there are multiple interference, like we have to rectify all this issue, because this is something a big research gap in this developing the sensors. So like we can address it. Like it's still there is a gap.
Okay, so still there is the temperature is not yet set for the sensor.
I mean, our intention is to develop the room temperature based sensor. So we just developing the sensor for room temperature. And to answer your question, like yes, they are sensitive to the temperature as well. We can change the temperature and test the sensing performances.
Okay, sir. One more query, because you're testing for sugar patients.
Yeah.
So generally we test it in the morning, as well as a random sampling also can be taken. If not, evening samples like after food and before food. So how does the sampling was taken for your study, sir?
This is something like there is something called as a Tedler bag. Like we have some Tedler bag to collect the samples just from the exhaled breath, and we have to process it before. This is something like we all use the pre-calibrated gases. So we have not taken this into the real-time application, but this is possible in real-time application. Our intention is to take this prototype to the real-time applications. Uh, Answering your question, we have to collect the samples in a Tedler bag, and we have to process it. Like we have to set it free for humidity, temperature, and so we have to collect only the VOC compounds, and then we have to send it to the sensing chamber. So that is the overall concept of this idea. And right now we are just using the pre-calibrated gases. These are something the results obtained from the developed gases, not from the real-time applications.
Okay, sir. Okay, thank you, sir.
Thank you.
Thank you, Priya ma'am. Any other queries, ma'am?
I think there's someone is raising their hand. Maybe.
I request everyone to turn on your video to take a group photo, please. Padmapriya ma'am,
Ma'am,
we can wind up.
1
now.
second. 1 second. On behalf of Biomedical Department, Ramapuram, I like to thank the speaker, Dr. Prashant Ashokan sir, for giving this wonderful section and this evening. I also thank all the participants who have spent their time for this session. I hope the session will be helpful for your research and other progress in your life. Thank you once again, Prashant sir, for the session and accepting our invitation for the short notice. Expect
Oh,
you for a future reference, sir.
thank you, ma'am. Thank
Thank
you
you,
so
my
much.
dear participants. The feedback is being circulated. Kindly fill the feedback for the today's section, sir.
Thank you, ma'am.
Thank you, ma'am.
Thank you, madam.